So I'm here today with Jon Harol, the president of Lighthouse Lab Services, and we're going to talk a little bit about his broader views on the industry in anticipation of Lab Week. It's always a really exciting time for the medical laboratory community, and it'll be coming up next month with the theme of Back to the Laboratory from April 24th to 30th. So, Jon, welcome, and thanks for giving me a few minutes here today. So, as we talk about, increasing visibility in the laboratory, and that's one of the things Lab Week is all about. Uh, One of the things you also mentioned in your bio is that, despite the majority of the decisions regarding a patient's diagnosis and treatment being the result of a lab test, most people don't know what a medical lab scientist actually does. So, what are a few things in your mind that lab scientists could do to be improving their visibility?
Sure. Yeah. I think it starts with even just that name and that title, right? You use the term medical laboratory scientist. I believe that is the appropriate title that should be used, and the one that's most aligned with how scientists want to be perceived. A lot of older scientists still say medtech, right? And when you survey the general public and you say medtech, a lot of people think of medtech takes your vital signs or your weight when you get to the doctor's office, and that doesn't help to really show the value of the degree that the medical laboratory scientist has received and the training they have and the knowledge they have of laboratory testing. And so I think some of it is the way that scientists refer to themselves is piece of it. I think advocating as well. The fact that the lab is typically in the basement of the hospital and out of sight makes it difficult. They don't have that patient interaction. And so the doctors and nurses, even pharmacists are interacting with the patient. So there's just a broader knowledge of what those professions do amongst the general public and the value that they bring. And we see that played out when it comes time for nurse week versus lab week. There's a lot more hoopla around it, right? And so I think part of it is trying to gain some visibility. The way that we refer to ourselves, advocating for the value of lab is really important. You touched on the fact that the stat that is always thrown out is 75% of medical laboratory decisions are based on lab data. Only a little less than 3%, 2.5% of healthcare dollars are spent on lab. There's a misalignment there, and I think that advocating for better visibility is key. I think that there's a really big opportunity, and a lot of it has been capitalized on during COVID. COVID's a terrible thing for the whole world, but there is a silver lining in the sense that people are aware that laboratory testing is important. They're aware of the work that laboratories are doing. They maybe know the name of a laboratory that they never did before. And so I think we're in a unique moment in time to go ahead and advocate, and we have the attention of the whole world.
That's a really good point. I think a lot of people have become just more aware of the role of a medical lab scientist through the whole COVID experience than they ever had previously been before.
Yeah, your neighbor knows what PCR testing is and wants to talk about it. That's never happened, right?
Absolutely. Yeah, and I think another thing that you mentioned that I had never heard until you threw this stat out at me is that less than 3% of healthcare dollars are currently spent in the lab. What are some options or ideas that you have for medical lab scientists to gain a better seat at the table, so to speak?
Yeah, I think that's really key. There's a lot of conversation going on right now about Clinical Lab 2.0, this new version, this value-based care model versus the traditional fee-for-service model. How the laboratory fits into that is still up in the air and being debated, and is a complicated thing. I think it's going to be difficult for laboratories to really shift the work that they're doing away from fee-for-service. I think that the payers, providers, health systems will shift away to a value-based system where they may get paid a monthly fee for a patient, and they're going to be responsible for all costs associated. I still think that lab will probably not share in that risk pool, or at least will not be paid on a per month per patient basis. I think it's more likely that physicians might pay that are receiving funds from a commercial payer will pay a fee for the laboratory tests that are being performed. One model that I've seen with a client that we're building recently, and I think it has some parallels with the pharmacy. So if you think about the fact that pharmacy and lab are both ancillary services, And I know I was talking to a lab director at a health system recently, and she said, I bristle whenever I hear the word ancillary services because it means extra, peripheral. And when you think of the fact that 75% of decisions are made by it, we're not ancillary, right? We're core, but it's not perceived that way. And even being framed in that way puts us in on the outskirts and doesn't give us a seat at the table. Pharmacy is also in that bucket of ancillary services, but we see that pharmacy has done a really good job of putting themselves at the table and maybe even at the head of the table. And I think we could copy that. And I'll go over one model that I saw that I think does that. But if you look at CVS, Walgreens, they've created minute clinics. They are starting to provide care. They're becoming urgent cares, right? So they're not the ancillary anymore. Now they're receiving the dollars and they're paying it out to the different parts of the health system. And I think who's in control of that relationship with the patient is in control of, kind of the power, or, if you're the one that has a relationship with a patient, you're at the head of the table. And so how does a laboratory get to a point where you have a relationship with a patient? COVID has showed us a few of those ways. And so as this pandemic moves into an endemic, I hope we don't lose the lessons that we learned throughout it. And some of those have been technology in direct patient relationships, telemedicine as a way to deliver laboratory services, and drive-throughs and pop-ups. There's just so many different ways that the laboratory can be more in contact with the patient. I think we need to seek those out. We're building a laboratory for a client right now, and their model is that they will advertise and go after people with certain conditions, one condition in particular, and advertise to them directly, kind of like you would see a pharmaceutical commercial, right? Where they would advertise for people that are experiencing certain symptoms. As those people reach out, they use a telemedicine physician to go ahead and go through their symptoms and vet them and diagnose them. And so the laboratory owns the relationship, but now they're paying a few dollars or a few percentage points to the physician to do that diagnosis. They also do the laboratory test, and based on the laboratory test are able to connect them with the physician to do the prescribing, right? So the laboratory in that situation owns the relationship, and out of the $100 they receive, they pay $2 to the doctor for doing the diagnosis, a couple dollars to another physician for writing the scripts, and are able to deliver pharmaceuticals as a result of that. And so that's a unique model where I think it moves the lab to the front of the table. Whether that's reasonable for a laboratory inside of a health system, maybe not. I do think that labs are best positioned to stratify patients and identify what their risk factors are through some initial early screening tests. And so if we were to look at a model of trying to solve some of the big issues, say like chronic kidney disease was one I heard a presentation on recently, if the laboratory was to start screening those patient populations, figure out who the people are that have risk, and then start connecting them to services, they change their position at the table for sure. So I think, first of all, let's not be ancillary, let's be core, and let's figure out how to be strategic and not just wait with our hand out for our 2.5%. Let's go figure out how to think in terms of business. And I don't think the laboratory has really done a great job of thinking in terms of business in the past.
Absolutely. That's a really interesting comp between the pharmacy as a more visible ancillary service and something that you could possibly, model yourself after moving forward for the industry.
Sure.